Mariella, and I will discuss whether oral bovine lactoferrin supplements treat iron deficiency anemia. With the help of several research papers with studies including a human clinical trial design, a randomized, controlled, double-blind trial, and a randomized controlled animal trial, I was able to use all of this evidence to build my own possible conclusion. I also did my own research on oral bovine lactoferrin supplements and compared that to the research I saw on another supplement called ferrous sulfate. Ferrous sulfate is a common supplement taken to treat iron deficiency anemia, but with the research I conducted, I was able to see why one supplement was better than the other to treat this. Some possible side effects of this supplement include nausea or vomiting, stomach discomfort, heartburn, loss of appetite, and constipation. This led me to wonder if there were better supplements compared to ferrous sulfate. First, I want to explain what iron deficiency anemia is. That is when one has insufficient iron, and without enough iron, the body can't produce enough of a substance in red blood cells that enables them to carry oxygen or hemoglobin. And as a result, iron deficiency anemia can leave you with various symptoms. For example, you could feel extreme fatigue, weakness, pale skin, chest pain, shortness of breath, headaches, dizziness, cold hands and feet, inflammation of the tongue, and brittle nails. Iron deficiency anemia develops in 3 stages. The first stage is when your iron stores are depleted, and the supply of iron to make new hemoglobin and red blood cells is dwindling, but it hasn't affected your red blood cells quite yet. The second stage is when your iron stores are low, and the normal process of making red blood cells is altered. In this stage, your bone marrow makes red blood cells without enough hemoglobin. And the third stage, iron deficiency anemia develops since there isn't enough iron to make hemoglobin for the red blood cells. So in this final stage, the hemoglobin concentration will drop below the normal range. At this point, you may start to notice iron deficiency anemia symptoms. Having severe iron deficiency anemia could increase the risk of developing complications that affect the heart or lungs, like heart failure, where your heart cannot pump enough blood around your body at the right pressure. There are several dietary supplements that can be taken to help treat iron deficiency anemia. Some include oral bovine lactoferrin, which is where I put my research focus on, ferrous sulfate, and ferrous gluconate. Focusing more on oral bovine lactoferrin, this is a milk-derived iron-binding glycoprotein that possesses good gastrointestinal tolerance and has fewer side effects caused by taking a high dosage of iron. It is also present in other body fluids like tears, saliva, bile, pancreatic juice, and nasal secretions, but can also be a capsule-like supplement, which is in pill form. Ferrous sulfate, on the other hand, when taken in large quantities, especially, can cause many side effects like gastrointestinal discomfort, nausea, vomiting, diarrhea, and constipation, like I mentioned earlier. Focusing on the pieces of research data I read, they did different types of studies to find a similar conclusion: if oral bovine lactoferrin supplements treat iron deficiency anemia. In one article I read, it had the goal of comparing the effect of lactoferrin versus oral ferrous sulfate for the treatment of iron deficiency anemia, specifically in children with IBD, which is inflammatory bowel disease. They did a human clinical trial design that included 92 children with IBD and IDA, but only 80 children completed the study and were randomized into 2 groups. The first group was a ferrous sulfate group who received ferrous sulfate 6 milligrams a day for 3 months, and a lactoferrin group who received lactoferrin 100 milligrams a day for 3 months. They were able to find hemoglobin, mean corpuscular volume, serum iron, TS, and serum ferritin significantly increased, while TIBC decreased significantly after the administration of either ferrous sulfate or lactoferrin compared to their baseline data. Also, lactoferrin significantly increased hemoglobin, serum iron, TS, and serum ferritin compared to ferrous sulfate, which also significantly decreasing IL-6 and hepcidin levels. With this evidence, they concluded that lactoferrin is a promising effective treatment with fewer side effects than oral elemental iron in children with IDA. Another study I researched included a randomized controlled animal trial. The goal of the study was to learn the effects of maternal lactoferrin supplementation on the iron metabolism of Dahi piglets. Dahi piglets, for reference, are a Chinese indigenous pig breed. Their study included 60 sows assigned to 5 groups. A control group, which was the basal diet without iron supplements. They were supplemented 100 lactoferrine, which was the second group, 200, which was the third lactoferrine group, or 300, which was the fourth lactoferrine group. And these were all in milligrams in the basal diet, and the basal diet supplemented with 100 milligrams of iron as ferrous glycine, the serum. Antioxidant parameters of the piglets and neonatal piglets were determined. They found that the serum antioxidant parameters of the piglets were determined, which led to the iron contents, antioxidant gene expression levels, and iron acquisition genes being detected in their liver, heart, spleen, and other neonatal organs. These results tie into whether oral bovine lactoferrin supplements are a good treatment option for iron deficiency anemia, because they claim that maternal lactoferrin supplementation showed remarkable effects on iron storage in neonatal piglets and exhibited strong antioxidant activities, which is helpful to prevent iron deficiency and improves the immune function of animals. Based on the research I did, I found that oral bovine lactoferrin supplements are a good option for the treatment of iron deficiency anemia. Through various research studies, which included human and animal trials, they both found that it had fewer gastrointestinal side effects compared to other supplements, while also being a helpful treatment on iron storage and possibly exhibiting strong antioxidant activities used to prevent iron deficiency. Although this was just found in animals, it is possible that could be for humans as well. Thank you for listening, and I hope you enjoyed my presentation.